2020. As you can see, we are all 5 present today, so it's great to see everybody back today, and Mr. Chambers and Mr. McInnes are here as well. And we do have staff and visitors in the audience today. So we'll move on down to approval of the agenda. 2.1, changes to agenda and approval of agenda, and we do have one change. Consent agenda added item 8.20, request closure of the Riverside Elementary School Child Care Program. So at this time we have no recognitions, no visitors, no administrative personnel's. Public comment, we do actually have a blue card this morning. And this would be members of the public desiring to address the school board, Form MIS 5241, public input and/or discussion of agenda items. Mr. McInnes, before we have our speaker come up, would you please explain the rules to public comment?
You'll have 4 minutes to make your presentation to the board, and I'll give you a 15-second warning when time's almost up.
Okay. And we do have Josh Morris. If Mr. Morris, if you would please come to the podium, state your name and your address for the record, please.
My name is Josh Morris, 814 Flower and Path here in Niceville. I'd emailed you all this information I'm going to cover. I just wanted to present it for the broader public. For those that responded, I appreciate your time and thank you for that. Mr. Chambers, there's a letter signed by you from the district strongly recommending the use of masks everywhere where social distancing cannot be maintained, with the caveat that there'd be continued discussion with employees and parents, which is why I'm here. I've got scientific data presented by doctors in the field over the efficacy and the effectiveness of masks in schools for children, and I'd like to go over that data. Klumpus et al., one might argue that fear and anxiety are better countered with data and education than with a marginally beneficial mask. They were published in the New England Journal of Medicine in May and clearly identify that mask wearing provides little protection from infection outside of a healthcare facility or other closed environments, unless it's added to already standard practice of hand washing, eye protection, gloves, and a gown. Their initial work was obviously to push for universal mask wearing. They highlight that significant exposure for a person means face-to-face contact within 6 feet with a person with symptomatic COVID-19 and not asymptomatic, and that's sustained for at least a few minutes, some arguing more than 10 minutes and up to a half hour. Their conclusion was that expanded masking protocols' greatest contributions may be to reduce the transmission of anxiety over and above whatever role that the mask may play in reducing transmission of COVID-19. Brousseau and Setsema in the Center for Infectious Disease Research and Policy of this year encouraged the masses to not expect a cloth face mask to protect them or those around them. They posited that mask mandates were not based on sound data, that their article for the Center of Infectious Disease Research and Policy highlights that the CDC excluded the National Academy of Sciences rapid expert consultation on the effectiveness of fabric masks for COVID-19 pandemic, that fabric masks may reduce the transmission of the largest respiratory droplets. Little evidence regarding the transmission of small aerosolized particles of the size potentially exhaled by asymptomatic or pre-symptomatic individuals with COVID-19. McIntyre and Hassanein go on to state that seasonal coronaviruses are more prevalent in aerosols than in larger droplet forms. Airborne vector of the virus would necessitate the use of N95 masks, as we've been preached to, rather than standard surgical masks or even cloth masks. The filtration of cloth masks is much less effective than that of surgical masks. The World Health Organization, prior to all of this, even recommended against mask wearing, instead opting for hand hygiene and social distancing. McIntyre et al. Stated that a randomized trial of cloth mask efficacy was conducted in 2015 and found substantially higher lab-confirmed infection rates among healthcare workers that donned cloth masks versus those that wore surgical masks. They also concluded the dangers to wearing masks can increase infection rates even when double masking due to the moisture retention, liquid diffusion, and pathogen retention of cloth masks. So my question after this, so who's prepared to outfit their small child with an N95 mask that, to be worn properly, has to be mask fitted, for them to specifically be able to wear it only for them and
15
deal with the headaches and
15
other side
seconds.
effects
15 seconds.
that many healthcare workers complain of the mask causing. The two questions that I have for this board and for you, Mr. Superintendent. The data doesn't support COVID-19 as a more dangerous threat to our children than influenza historically has. And given the time, I wasn't able to get to that. The research does not support a mask-wearing mandate to combat COVID-19 as a viable option for school children. And as a concerned parent of an elementary-age child, there's no relevant data to support governance mandating or even strongly recommending masks for children in a learning environment. So what punitive measures are going to be taken against the children that do not wear a mask in these schools? And second, what assurances do you provide that the more overbearing educators employed in the schools will not somehow intimidate children into strongly recommending that they wear a mask?
All right, thank you.
Thank you.
Okay. So now we will move down to Section 7, Committee and Staff Reports. 7.1 is in-county travel paid for the period of July 23rd through August 5th, 2020. And then 7.2 is out-of-county travel paid for the period of July 23rd through August 5th, 2020. And then we're at Section 7.3, update on reopening schools during COVID-19. And Mr. Chambers, I will pass this off to you.
Thank you, sir. I think as the board knows, I want to have a discussion about masks today. And I think you also know our current stance right now in our reopening schools plan is to strongly encourage masks anywhere where social distancing